Welcome everyone. Welcome back to a lot of us. I'm actually really glad to see that some of you enjoyed our previous webinar enough to continue joining us. And for the new ones, welcome to this COVID-19 focused online session, which is part of a series of webinar and training we have been offering in the frame of our COVID-19 response. Basically, since April 2020, TG has been assessing the challenges trans communities and trans-led organizations are facing, from which we identified some crucial areas of information and capacity building needs. Hence, throughout the month, basically since April 2020, altogether, we tackled, exchanged about, and trained ourselves on various burning issues that were flagged as the community's priorities. So online campaigning, financial stability, COVID-19 reprogramming, UN advocacy, and digital safety. For our final webinar, we want to give the space to those who in times of crisis are further marginalized and structurally invisibilized. Those who are homeless, sex workers, disabled, migrants, refugees, asylum seekers, Black and people of color, poor, elderly, trans women. Working for the liberation of further marginalized people is key to the liberation of all. So I'm very thrilled to have you all with us today as we'll have the chance to listen to the input of 4 trans activists from organizations working hard to support their local trans communities. So they will be sharing insight on how COVID-19 is impacting most marginalized trans communities, as well as tools and best practices. So you will see them shortly, but we'll have the pleasure to have with us Sabrina from APROSEX based in Spain, from Sean-Claude from Man.ish based in the Netherlands, from Antonella from Sex Work Hall based in Romania, and from Diana from Labris, and she is based in Russia as a migrant. In a second phase of the event, we will split the group into smaller groups and will be joined by donors from foundations that support trans organizations. I can already see some of you there, but to name few, we will be joined by ITF, Mama Cash, OSF, Westspring, Urgent Action Fund, and GPP. It will be a space for us to have an activist and donors discussion, bring questions, and get input and recommendation on funding and fundraising. And as always, I would like to thank TG staff for their work on the preparation of this training, especially my colleagues that you can already see on the screen, Sanja Kormanov, Milena Papakosh, and Mason Davis, who will be moderating the second half of the session. So you will hear from all of us. And thank you to our panelists, of course, who are kind enough to come and share the expertise with us. So that's pretty much it. But finally, before giving the mic to our first panelist, Sabrina, I would like to introduce some important technicalities that some of you might know by heart by now. So regarding privacy and safety settings, you want to know that this session is not live streamed, but it is recorded and it will be shared on our social media later. As this part will be available to the mainstream, for safety reasons, all your camera and microphone are automatically off. If you wish to switch on your camera and microphone, please do so. For us, it's really always more comfortable to be speaking to actual faces rather than dark screens, but also do keep in mind these settings for your own safety. Regarding accessibility, keep in mind that for a large majority of us, English is not our first language. So please use simple English, avoid acronym without explaining them. As you have might already have seen, this training is live captioned in English. If you can't see the caption, click on the CC button at the bottom of the screen. And we are also offering simultaneous Russian interpretation. Thank you, Vanya, once again. And as it is quite new for us, we might encounter some technical problem with that. So please be patient with us. If you want to listen to this webinar in Russian, click on the button at the bottom of the screen. Finally, this session will last 90 minutes and we'll start with the first part, input-based, basically a panel. The second part will be more interactive and you will be split into smaller groups in breakout rooms. That's pretty much it. Sorry, it was a lot of content, but I think not as important, not barely as important as the following inputs. So if you have any question during the session, feel free to use the chat. I'll stop now. I give the floor to Sabrina and wish you all a great session. So Sabrina, whenever you're ready, the floor is yours.
Good afternoon, everybody. It's really a pleasure to be here with you all. I also see very known faces like my co-panelist Sean here from Amsterdam. So always thinking about you guys. My name is Sabrina Sanchez, as Anwar already said. I'm in representation of APROSEX, that is the Association of Sex Professionals. It's not specifically trans association, but we have a lot of weight in the association. It's like we are becoming more trans focused because of there's any specific sex worker sex worker organization focused specifically on trans sex workers, but basically it's this segment of the population, and also because of the people that is conforming APROSEX right now is what we focus more in this COVID pandemic. As you know, in Spain, we are still suffering with the numbers of the infections. We are still not able to travel. In fact, I was supposed to be in Belgium these days for a meeting, and of course, I couldn't do it. And there's been a lot of institutional disorganization in this, but we will get to that. But what COVID did in Spain, basically, was to uncover totally all the inequalities and all the things that we have been carrying since 2008 from the economical crisis, with the labor reform that had been made, and also rights that coming back. That it's happening like everywhere, not only in Spain, but also in other places, as we know. So this pandemic, the only thing what has done to stress a little bit more all the vulnerabilities that we already knew, that we already been fighting against. It came to stress the need of proper housing for trans folks, especially trans women, because given our numbers and our experience, at least here in Spain, we find that the average of trans masculine folks with a proper job, with a regular job, it's bigger than the female trans folks. And given to that issue, that this lack of access to the regular labor market for a trans woman makes us to rely in sex work. That it's obviously and things that we already know, that sex work has always been our salvation device for basically for trans women and trans women of color, trans migrants, etc. So the reality that this lack of access to the labor market makes us even more vulnerable, because we are not able to access proper housing. We go basically, when we do sex work, we go from city to city, and we do we call it plaza, where we stay we do our tours from city to city, and we have to pay for that for that housing. Obviously, we have to pay very high prices to live and work there, as you know. And of course, with this COVID pandemic, this housing issue has been really terrible, because for example, it's not our case exactly in trans women, because we are not usually hired at the brothels where the cisgender women are usually hired. Our number is very small there, so our So the fact that the brothels have been shut down with the confinement, and now that they are also shut down in some Spanish regions too, doesn't really affect us very much. But what is happening to to trans-sex workers in Spain is that we have been accumulating debts on that housing. Of course, with the confinement, it was illegal to throw someone in the street, to evict someone. You could not do it. But at this moment that there's not a state of emergency, state of alarm in Spain, that it's like almost normal, we've been finding that transit workers have been evicted because they are not able to pay the rents. And of course, with this pandemic, clients are fearful of getting the virus. Of course, we are all fearful. So what we have found is like a lack of response of the Spanish government in the complete sense of the needs of sex workers in general, sex workers of any gender expression or any type. We are completely forgotten. They have announced big packages, big reliefs for persons in context of prostitution. That's what they named it. And of course, everything is related to trafficking. Everything is related and focus on a specific type of cisgender women that they find that is like the perfect victim, that it's like, that goes exactly in the standard of the victim, that is according to the Spanish institutions at the moment. So many of us, of course, like 90% of trans sex workers are not being trafficked. We have come to Europe in order to improve our living and in order to be safe, because some of us come from Mexico, like me, and we know there's a lot of Brazilian trans sex workers and around all Europe, and we basically fly because only for saving our lives. And what the Spanish government is really doing is completing the extermination. Completing the extermination, even though they proclaim themselves, they name themselves as the most progressive government in Spanish history, and it's a feminist government, and nobody will be left behind in this pandemic. Unfortunately, in the theory is that nobody was going to be left outside, but in practice, the fact of thing is that all the requirements that are needed to access to all this relief measures, to all this government helps for the vulnerable people, they're not arriving. In fact, I think the last number is that they have only approved like the 1% of all the applications since June 15. Of course, all the bureaucracy is has lack of funding here in Spain, years of cuttings in budgets, and well, this is again the result. And the problem is the Spanish government is not willing to meet up with any kind of sex worker group. In fact, we have this problem here inside the government in Spain about the trans law that was going to be approved, I think like 2 years ago, and they're still on a drawing. And we are also facing this backlash from terrorism inside of the structures of the government and inside of the structures of the Socialist Party, that is the main associate of this government. So things are not going well in Spain. Things have becoming, since as a migrant, I'm going to put it this way. As a migrant, I can see, since I can compare since the time I came here, it was 15 years ago, and this time, and it has no difference. It's another country. I arrived in 2008 with this reforms by Zapatero, equal marriage. The current law that it's not enough for gender recognition, that it was good at the time, but it's still the same law, and 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 with the time started to become like worst. So I think that as an European institution as TUR, or the TU is, sorry, um, I think that we have to push also for a real uh, talking, a real conversation at European level about the laws about sex work, about decriminalizing sex work, about calling the attention of the institutions that in 20 years of Swedish model, it's been terrible for not only for cisgender sex workers, but mostly for trans sex workers, for trans people of color, for all the marginalized, has been like devastating throughout the years, for 20 years of prohibitionism. And now we're in the peak, really, the really turning point moment that maybe that we have to push to switch these policies, because otherwise we're still not we still not have rights as workers. We are not recognized as victims. We don't recognize ourselves as victims. So we need to push for governments to be brave and approach these social issues, because basically, if our work was recognized, um, we will be having like this lot of problems that we are currently having right now, social problems that could be addressed with the basic fundamental labor rights for work that almost like according to the numbers, almost the 80% of trans women do it for survival.
Thank you so much.
I heard that. Yeah. Okay.
Yeah. Sorry, I have this annoying job but you almost right on time. 12 minutes. Thank you so much for this incredibly comprehensive input. Thank you so much. And sorry, I will be the annoying person for each one of you.
Don't worry, I've been there in your place and it's horrible. So,
okay,
so don't worry.
Thank you. So thank you, Sabrina. And now I'm just going to directly give the floor to Sean-Claude, speaking from a Man.ish Cave organization based in the Netherlands.
Hello again, everyone. Thanks for having me. And thank you again, Sabrina, for your input. You know, it is very sad and unfortunate that we have to, be surviving double time. We have our daily lives with transphobia and everything that comes with that. Now we have to deal with this pandemic, but we are resilient and we will carry on. So thanks again, Sabrina. Thanks again for having me, TGU, to share. Timekeeper, when I'm at 2 minutes before the time, please let me know. 2 minutes before the end time, okay?
It'll be a pleasure.
Thank you. So let's get right into it. I don't know how to start, because the truth is, when I was asked to share, I was like, okay, I need to find some information. And I did some research, and unfortunately, in the Netherlands, based on my research from a governmental perspective and from big LGBTIQ-led organizations, there are limited to no support and surveys done on the effects of COVID in the Netherlands. Limited to none. Specific to Black and people of color and the trans community. However, I did find some surveys that was done by SIA AIDS Netherlands and Utrecht University, which centers men and trans people having sex with men, and how the effects of COVID has affected their sex lives with the said group. The survey is online, and persons to participate can get a gift card valuing 25 euros, and it's only 20 cards. And this survey was posted on COC Amsterdam's website. And I also checked COC Netherlands, and they actually started a survey a couple of days ago, from August 11th, and it will end in 3 days' time, September 13th. And the results will be issued in somewhere in mid-October. Now, I also went on the government site, this government website in the Netherlands, and there was a statement, a general statement from Equal Rights Coalition, urging the government to basically put all the precautions in place to limit, the effects of the pandemic on persons identified LGBTIQ, gender identity expression, and sexual characters. So basically, these are just very general surveys, nothing specifically geared to the trans community yet. It's just very broad here, and I found that very sad. However, ILGA Europe did a rapid assessment report providing specific reference on COVID and the effects on LGBTIQ persons in Europe and in Asia, Central Asia. The survey was open from June 1st to June 18th. However, the report should be viewed as a rapid access report because it's not a formal report, and how the data was collected was not done in somewhat of a formal way. And you can read more of this in length on on ILGA Europe's website. So when I did my research, that's what I found. Nothing specifically catering to find out the needs and the effects of COVID on trans people in the Netherlands, which is very unfortunate. And these are very big known organizations, and nothing was done, which is unfortunate. However, I will come to you today with effects from what we gathered from our organization Man.ish and our interactions with the community this year. Basically, we found that in conversations with persons within the community, we found that healthcare was definitely an issue. Persons were really lacking in efficient healthcare, trans healthcare, i.e. Getting their hormones specifically, and also surgeries. A lot of surgeries were put off because of the pandemic. And the trans-led clinic in the Netherlands was closed due to the pandemic as well. So other alternatives for undocumented trans persons, sex workers, to get their hormones was on hold for some time. And also trans-related medical care was also on hold. However, therapy consultants were done via phone from the VU Gender Clinic. And how I know is because myself and two other trans masculine persons received the call in doing this that I know about. So this is how I know that this is happening. The main thing really that we encountered with the trans community, and just a little background, Man.ish supports the trans masculine Black and people of color community here in the Netherlands. So our interaction was mostly focused on the trans masculine community, and confinement seemed to be the most challenging for the trans masculine community, as our meetings were like somewhat of a safe haven to the community. But however, we also hosted most of our events online, and we found that that was helpful. Another effect was that the Black trans masculine community has been re-traumatized by the recent deaths of George Floyd and Tony McDade, and also everything that came up with that, the constant reminder, the the global protest. In conversations that we had, we found that specifically the Black trans community was like, it was re-traumatizing, it was crippling knowing that we have this pandemic to survive, and also now we're still being killed. Even though in the Netherlands, it was not that, if we weren't affected by police brutality per se, no. However, the repercussions of that, you know, it was enough, and we definitely came out in our numbers, and we did say enough is enough. We also found that there was
Jean-Claude, you have 2 minutes left.
2 minutes. We also found that there was no trans-masculine or Black trans community. We weren't visible at all, so we found it very difficult to come together and have a community and support each other. And the leadership was very overwhelmed, and it was easily for us to be burnt out. So even to try and keep up and support the community as we should, we weren't able to do so because we had to deal with the effects ourselves, and how the effects of COVID on us, and also managing our community. So we saw signs of burnout. How we manage these impacts were, assistance was done to support trans-masculine persons with testosterone and T-shots. I myself have done that with some trans-masculine persons. I had some in stock, gave T-shots, and gave some T-shots. As I said, we hosted our online. We had all our events online, so it was kind of easier for us to engage with the community and to give that sense of, saving grace, safe haven that will help support the community. And we also prioritize Black and people of color, giving them more space to share, just to, de-stress and just to share whatever is on their mind, given the current pandemic and the effects of that. We also, for the leadership, we had recreational online meetings for ourselves, outside of work. We just had meetings, we played games online just to de-stress, and so we can engage the community better. And our future, our priorities and strategies for 2021 is basically to have a physical space. We found that having a physical space will be very important to center the trans-masculine community here in the Netherlands, because, to be honest, we are not a community per se. We are all scattered, so it was very also challenging for us to come together and give that effective peer support that we needed to. So a physical space, we're definitely looking into getting a physical space, seeking more funding, and also with the establishing a physical space, we'll establish a more visible trans-Black community. We are looking into having more leadership retreats, of which we will have in December, to help with manage the burnout and the de-stressing. So yeah, I think that I saw you do this.
I mean, right on time. It's impressive. Yeah, right when I was unmuting myself. Thank you, Jean-Claude, this time. Time is up.
Thanks.
Thank you so much.
Thanks for having me again.
Thank you. And I just wanted, in addition to what you just said, I actually came to the same conclusion a few days ago when I tried to really do a comprehensive research, like globally, what kind of study can we find on the impact of COVID on LGBT people? And there are quite numerous, version of LGBTQ-led studies. However, when it comes to trans-specific studies, so far I found only this, German one that is, I think, still conducted, this Trans Care Handbook, and that's the only one I found. So please, if you have some hints or any, resources you want to share, please feel free to just share it on the chat. Thank you so much, Jean-Claude, for your input and for your thoughtfulness regarding time. And I'm directly going to give now the mic to, I can't see you, Antonella, on my screen. You might be up, Antonella. So yeah, 10 minutes, and let me know if you want a timekeeper.
So hello, everyone. My name is Antonella, and I am from Romania. I am the president of Sex Work Called Romania, the first sex work organization led by sex workers in Romania. First of all, I want to tell you that in Romania, especially in Bucharest, the trans community was twice harder attacked in the pandemic crisis. In the pandemic crisis, the public politicians give law against against all gender study, and he do this thing that because we was in pandemic and we cannot do a public protest, and this conservator senator just come with this proposal. We don't know if it pass or it not pass. We're still waiting for the decision of the constitutional court in Romania. The COVID-19 was a hard episode for the trans community. Us on Sexual Call Romania, if we work very hard before crisis, in the crisis, the work of us, it's double it. First of all, for the trans community, sex worker in Romania, it's very hard because we don't have documents. In Romania, having a documents, yes, we are in 2020, but a person having a document in Romania, an identity card, it's still a dream. It's sad, but it's true. It's very difficult to have papers in Romania, and these issues of don't having paper also make another issues that you cannot access to public health. So all the trans community left outside of the law, outside of the helping, and outside of everything, not even food. So we try to manage how much possible cases we can, but our resources also are very short. So we try to build community and put together more than 5-6 person in same apartment, because a lot of them coming from the outside because they are like immigrants in Italy, Germany, England, UK, and all these countries. But with the crisis of COVID-19, they must return in Romania. But if they return in Romania, they will return to their origin and to the episode transphobic every day. Because in Romania, being a trans, it's very hard. You will not have a hormonal therapy, you will not have medical access, you will not have document access. And this make a lot of community persons go outside in other countries looking for a better life. But this crisis returned them to Romania. And when they come to Romania, they were basically zero, don't having nothing, house, food, and all these things. And we have only 2 LGBT organizations which also have small resources, so they cannot help all the trans community. The first problem of them is access to medical health care. They want taking the treatment for HIV, but it's not possible because medical system treat more priority the COVID-19 cases. And this was very hard for transgender community because HIV treatment is very important for them. Basically, it's vital. And doctors prefer to help more the COVID cases and giving the second place of the person with HIV problems. And also in Romania, we are in the middle of the local elections, and this local election give opportunity to the all public parties to attack the transgender community. They was like the right wing with the left wing attack each other with the funny videos of transgender persons, making laugh of them and say, if you vote with the left, you're gonna have transgender in your house and all this bullshit. So yeah, we don't have a strong trans movement, but we are at the beginning of this movement, and we try to resist and to fight all this hard attack from conservator. Of course, we are very intersectional because we have a lot of transgender Roma people and members, and they face double discrimination even inside of the Roma community, also in the Romanian society. It's hard, but we're gonna survive, and we're gonna try to make it better. We collaborate for the moment with Global Women Fund and with ICRC Europe, International Community for the Rights of Sex Worker, which help us to found this first organization of sex work call in Romania. And for the moment, we have a project which we make interviews with all the trans members communities of sex worker, and try to make a kind of how to say certification, I don't know how to say a study about how transgender person pass to all these problem and issues in Romania. And that's all from us, from Romania. Of course, we have a lot of problem with also transgender person with disabilities. We don't have, but of course, not all, not even normal person with a disability in Romania don't have a very good life. So it's the same things even for trans community. And of course, this public videos of political parties putting on stigma on the transgender community, it's harder for us because Romania just 2 years ago passed through referendum gay, which was in 2018, and this year with anti-trans agenda, they say, anti-trans law, they attack all kind of minorities fight. So we resist. We are here, and we are working on making the world better.
Thank you, Antonella, and especially for the final empowering words. And thank you also for raising, attention as well on this, one of the biggest political consequences right now of the COVID-19 is that it just brought a perfect opportunity for, as you said, anti-gender and anti-trans movement to just, take advantage from the crisis to just push for legal and political rollbacks. And we see that, popping up in the whole European and Central Asian region, and just to name a few, in Hungary, in Russia, in Spain, in Kazakhstan. So it's really worrying. Thank you so much for bringing our attention to that. And thank you for your great inputs. So now we're going to listen to Diana, sorry, but first we will have a little, technical transition to do. So it might appear a bit strange, but I will ask to all English-speaking people to go to click at the bottom on the Russian button, so RU, and to all the Russian-speaking people to click on the English button, so EN. So I repeat, just because Diana is Russian, will be presenting her input in Russian, so all English speaker participants should click on the RU Russian button, and all the Russian-speaking people should click on the EN English button. Okay? Talk to you on the other side then.
Всем привет, меня зовут Диана. Я родом из Кыргызстана, работала в организации Лабрис. 3 года как мигрировала в Россию, сейчас работаю и живу в Москве. Я расскажу о ситуации с транслюдьми, а именно с трансженщинами, которые занимаются секс-работой, мигрантками в России во время пандемии. Карантин в России начался в конце марта и продлился до июля 2020 года. Москва была полностью изолирована. Передвижение по городу возможно было только по специальным электронным пропускам. То есть был очень строгий режим карантина. В связи с этим у транссообщества, которое занимается секс-работой, возникли очень большие проблемы. Это большая потеря доходов, многие остались без жилья, а шелтеры и кризисные центры не брали девочек к себе, потому что была большая стигма, трансфобия и хорфобия в отношении моего сообщества. Девочки были вынуждены все равно работать, потому что, чтобы прокормить себя и выжить, что выросло насилие со стороны клиентов. Это вымогательство, насилие, шантаж и угрозы разного рода. Также отмечается высокий рост насилия со стороны полиции. Это были рейды со стороны полиции. И участковые каждую неделю совершали обход и грозились выселять девочек. Многие девочки объединялись и жили в квартирах по 2-3 человека. И в России есть закон против секс-работы. И если в обычное время это был административный штраф в виде 1500 рублей, то во время пандемии был этот штраф, плюс еще штраф за притон, потому что девочек было много в квартире, и также за нарушение режима самоизоляции. В итоге штрафы возрастали до 10 тысяч. У многих девочек не было даже возможности ходить в магазин, в аптеку, не было доступа к гормонотерапии и к услугам психического здоровья, к услугам по сексуально-репродуктивному здоровью. Многие организации, которые работают с сообществами секс-работниц и транс-сообщества, прекратили аутрич-выходы, прекратилась раздача презервативов и любрикантов, также тестирование на ВИЧ и инфекции, передаваемых половым путем. Большинство девочек — это мигрантки из Центральной Азии. И, то есть из-за закрытых границ многие не смогли даже вернуться к себе на родину. Очень пострадали ВИЧ-позитивные люди, потому что они остались без антиретровирусной терапии. В России терапию могут получать только граждане России, то есть мигранты не могли получать. И возможность пересылки и получения лекарств из своей родины тоже такой возможности не было. Более того, в России мигрантов, у которых есть ВИЧ-статус, ждет депортация, поэтому с ВИЧ-позитивными людьми в России очень сложно. Моя работа, я равная консультантка для транслюдей, секс-работниц и мигрантов. Я начала свою работу удаленно. Фокус сменился больше на информировании по коронавирусной инфекции. Мы делились с девочками в чатах, в социальных сетях и мессенджерах о том, как обезопасить себя, как защитить свое здоровье. Также я занималась перенаправлением в другие организации, где есть психологическая поддержка и юридическая поддержка. Социальной защиты от государства специально для секс-работниц не было. И была соцзащита, но она касалась именно граждан Российской Федерации, то есть мигранты не могли воспользоваться социальной защитой от государства. Помогали внешние организации, это транскоалиция на постсоветском пространстве, которая помогала с продуктами питания и с гормонотерапией. Что еще хотелось бы отметить? То, что в России очень мало организаций, которые работают с моим сообществом, а тем организациям, которые существуют, очень сложно приходится. И вообще в России с правами людей очень сложно. Очень много дискриминационных законов, законы о гей-пропаганде, о пропаганде наркотиков, закон об иностранных агентах, существует криминализация секс-работы, существуют дискриминационные законы против ВИЧ-позитивных людей и иммигрантов. Поэтому даже организации, которые работают с моим сообществом, очень рискуют. И вся эта ситуация с пандемией представляет угрозу не только для отдельных секс-работниц, но и для общинных организаций. Да, доноры соглашались с тем, чтобы финансирование статьи из бюджета могли перераспределить на закуп средств индивидуальной защиты, но этого недостаточно. И я призываю доноров, которые работают с моим сообществом, с пониманием отнестись к необходимости изменить программы в соответствии с потребностями секс-работниц, помочь общинным организациям выжить и не утратить устойчивость, обеспечить непрерывность услуг на базе сообщества в ходе кризиса, рассмотреть возможность включения в проектные заявки бюджетных статей на непредвиденные расходы, чтобы в чрезвычайных ситуациях получить необходимую правовую помощь и другие услуги. Также призываю обратить внимание на ситуацию и начать работать с мигрантами. Также призываю признать секс-работу работой. Поддержите декриминализацию секс-работы, потому что это единственная модель, которая дает возможность соблюдать трудовые права секс-работников и обеспечивать им социальную защиту, медицинскую помощь в ходе кризисных ситуаций. Также в заключение мне хотелось бы сказать то, что не только в обществе, но и в ЛГБТ-сообществе транс-женщины, которые занимаются секс-работой, являются наиболее уязвимыми. И часто даже в организациях правозащитных, в ВИЧ-сервисных организациях часто игнорируются реальные проблемы транс-женщин, которые занимаются секс-работой. И мне хотелось бы, чтобы общинные организации в сфере прав людей, которые занимаются профилактикой ВИЧ, привлекали в свою работу транс-женщин, чтобы они получали образование, получали достойную оплату и могли задуматься о том, хотят ли они вернуться в секс-работу или увидеть другую жизнь, более достойную жизнь. Спасибо, что пригласили на этот вебинар. Это очень важно для меня и для моего сообщества. Ну, вроде я сказала. Спасибо.
Спасибо большое, Диана, что поделилась и подчеркнула важные моменты, а также дала невероятно важные для сообщества рекомендации, которые стоит учесть донорским организациям, и в том числе иметь в виду общую ситуацию и положение мигранток из Центральной Азии в России. Я думаю, что это очень важная информация для многих организаций правозащитных и НПО, которые проводят свою работу на территории России. И спасибо. Теперь я попрошу русскоговорящих людей вернуться к русскому языку и нажать кнопочку «Русский язык». И англоговорящих людей попрошу вернуться к английскому языку, нажать кнопочку «Английский язык». Спасибо.
Hi everyone. So I should be speaking now to English-speaking group, and the Russian-speaking group should be listening now to Vanya. Sorry for this, like technicalities. We didn't find any other way on Zoom to be really able to exchange, and not just the English-speaking group speaking and the Russian-speaking group just listening. So thank you everyone for your great input. Like really, I think it's a very important food for thoughts, and especially you tackled this question we raised in such a through such various angles. So thank you. It's very important. I think I speak on behalf of TG. It's also important for us to listen to our community members, our member organization, and our fellow trans community members, and to always be aware of what is the priorities, the most pressuring needs and priorities of our community, and to inform directly what is the work we want to do and we try to do on a daily basis. So thank you everyone for this great input.
All right. So we are really delighted to have both many wonderful trans activists here and some donors as well who care about trans issues, and wanted to have an opportunity to have a dialogue between some of those donors and the activists in real time. So as Anwar has suggested, we're going to be breaking out into two different rooms. One room will be with the Russian speaking activists in particular. The other room will be with the English speaking activists. And then we're actually going to ask the donors to go back and forth so that they're able to hear from both. So one group will be in Russian and interpreted, and the other will be in English. Did I get that right, Anwar? Correct me
Definitely.
if
And don't worry, I'm going to be the one kind of the wizard kind of assigning you to one room. So you will just have to click OK whenever I kindly invite you to go into another group.
So we're going to ask the donors to split up a bit. It's hard to tell in this format exactly who all is here because not everybody has their names listed. And I don't know if we have everybody, but we're going to hope to have a split of both of those. And on where we'll divide those up. And then when we get in the groups, Sanjar will be facilitating the Russian speaking group. I'll facilitate the English speaking group. And it's really an opportunity to have some dialogue and to ask some questions. So I know Sanjar and I both have some questions that we'd like to ask the activists as well as the donors, and then have some dialogue. I will say one of the things we have promised is that this is what we call a no solicitation area. That just means we have asked the donors here to be able to provide information and context and to be able to build relationships and hear from you all what's going on so that they can take that and to think about that in their funding throughout their institutions and to provide advice to us. They are not here with the ability to give money, okay? But I hope because of the many relationships and connections and knowledge that the donors have, that they will be able to have, I think, some good advice for us, as many of us are struggling to figure out how to survive and to take care of some of the gaps that were identified by the panelists, such as providing more support for trans sex workers who are struggling, more support for data collection, more support for these other issues that are so critical to us. So I'm going to ask everybody to not ask the donors for a donation today, because that's not why they're here, but that this will hopefully help open some other doors and connections for all of us who are trying to strengthen our organizations and our communities. So thank you for being a part of this. I really wanted to ask some of the donors if they'd be willing to share, what are your recommendations, especially for the smaller trans groups that may not have access to funders, you know, maybe perhaps are seen as too small for an OSF or some of the big funders or the governments in their areas. What do you suggest as they are trying to figure out where to find resource to survive in this moment and to make sure that those who are most marginalized and most impacted by COVID are able to be okay? What would your recommendations or suggestions be if you'd be willing to share?
Well, sure, I'll hop in. I would say to, if you have a relationship with one donor or have ever talked to any person from a foundation, don't hesitate to use that to learn more about like the foundation community and to literally just ask the question, who else should I be applying to? Because they will be able to tell you, okay, that foundation is a waste of your time. They don't fund in your region. That foundation is looking to expand in your region. Donors tend to know what other donors are up to and can really say, here's a good use of your time. Here's what's not a good use of your time. I also think it's always, once you've applied to one foundation, it's always a great thing to ask them to send your application on. If you know anyone else that might be interested, please send this on. That's a really typical thing for donors to do. And it's an easy way for us to be advocating for the groups.
Thanks.
Greg?
Good.
Yeah, I think another way to do it, although not ideal, I understand, is to work in partnership or collaboration or consortiums with other groups. So very often, yeah, a donor like us, OSF, you just don't have the ability to fund as many grassroots organizations in as many countries as we even would want to. So unfortunately, very many foundations like ours have either geographical priorities or type of work we'll support. But very often we can fund, consortiums or groups that are working with other groups, or we can fund large organizations like TGU to do sub-granting. So that's one way to also show donors that you are part of a bigger movement, that collaborative aspect. Like I'm saying, I know it's not ideal, because ideally we would get you general supports, very flexible funding directly to organizations, but that's just not realistic in many cases. And so this way, if you work with a bigger organization, either in your country or regionally, explore potential projects or work to pitch to donors, it might also work.
Thanks. I see we've got somebody, at least one person from Urgent Action Fund, and I was wondering, Elsa, if you or somebody else would be willing to share kind of a little bit about the fund, and so people know that that's there and when that might be useful.
Absolutely. First of all, thank you, Mason, for all of this, and Anwar for moderating. It's beautiful. I just want to share that Urgent Action Fund, as its name says, is a funding organization or a grant-making organization that focuses on times where there's an emergency or a threat or a risk or a big opportunity for women or trans-led organizations or movements or individuals on the front lines need that support. So this is mainly what we focus on. We have two types of grants, the security and the opportunity grants, whereby the activists on the front lines would be the ones who would decide what the security aspect of it is and what the opportunity aspect of it is. And given all of that, I've already shared with the Russian group that we had, the Russian speaking group that we had, that the same way that any group searches for a donor, donors also search for people to fund, always. So it's important that just my piece of advice would be, as Urgent Action Fund, to do the work that you're doing the same way you are, just to make sure that you're connected to the movements you need to be connected to, and you're as visible as you need to be. And that's how basically any donor organization would be able to find you. I can see Victor, for instance, we speak all the time, even though we're in two different funding organizations, but him being connected to certain parts of the movement, me being connected to other parts of the movement, and each of those movements being connected to their own needs is what makes us find them, and then what makes us help each other find each other's respective organizations. So as simply as I can say, just do what you need to do and we will find you the same way you find us. So that's my piece of advice in terms of visibility, as much as you can, obviously, given the security aspect of it and the risks surrounding your work.
Thank you so much. We have two more questions, final questions from civil society. Before we do that, I just wanted to ask, since we don't always get time with the donors like this, for those who are donors, are there any other tips or suggestions you'd like to make for the groups? And especially the groups in Central Asia, where oftentimes there's not as much funding.
Maybe I can just add as a reminder, I'm Sophia, I represent Mama Cash, based in the Netherlands. We normally support with the groups that are working on the grassroots. So again, I mean, to add on already what was shared, don't be afraid to approach the donor, even if you know one. You might be connected to the other networks as relevant. And we, for example, also support unregistered groups. So if you are not registered, that should not be an issue.
Thank you. Mukasa? I saw you raise your hand.
I was actually going to say the chat box.
Oh, we've got a bad connection, I think, Mukasa.
Thank you, And so regarding grassroots groups, smaller groups, I just want to say that the ITF moves. Hello, can you hear me?
You're in and out a lot, Mukasa. I don't know if there's a
Box,
different position to be in.
I'll just type in the chat box.
Okay. Thank you. That'd be great. I'd like to hear your learning. Mukasa's been doing a lot of grants to small groups around the world and has learned a lot through that. Any other donor interventions? If not, let's have a couple of quick questions then before we close out. We had, just make sure I'm correct on the queue here, Sabrina.
Well, it wasn't more like it wasn't just that, it wasn't a question, it was more like a comment, given the question that we have in one of the groups. It was very important, because how the donors and activists can work together. So maybe we can have, in this moment, we need two approaches. One could be like in short term, like in order for the effects of this pandemic. We should be able to have access, at least for this, maybe a couple of periods of granting more access, or for our organizations for core funding. Ourselves, we've been receiving core funding from Cash. I'm going to say it because it's public anyway, and it's been absolutely helpful in that moment, because that give us the freedom and that confidence to use the fundings on what we feel it's the need for, because and this pandemic has, you know, this shows that very clearly, because we could have applied for a project, for a funding for a project, and maybe in this year with this pandemic, like it was, we all know that we all having been changing plans. We have all the organizations that maybe we have budget projects for meetings or traveling or whatever, and everything it's over for the moment. But maybe in this periods until maybe we have a vaccine or something, to have more access to core funding, to make it more accessible, and maybe the other organization, the other funders, you can also make some pressure to at least for temporarily, let's see how it works, to have better access to core funding. And in the long term, that also helps that as Victor pointed also, like to have more representation and the founder organizations and other places when we basically don't have representations, not as migrant trans individuals, not as Black people of color individuals, not sex worker experience individuals. So we need to be there, so you can know our needs firsthand and be able to collaborate in the same level as partners, as part of the same team, to address better the problems of the communities that we want to support. And thank you.
Thanks. We have a few questions that came in from Central Asian activists that I want to mention, and to see if any of the funders can address this. One is, what kind of support is available or could be provided in Central Asia? And there are many requests for surgical correction from trans people, or access to healthcare and transition-related care. Is that something donors can help with? And a third, to what extent do groups need to explain the specifics of their country context when they're looking for resource? Like, how much do they need to be telling donors about what's really going on in their regions? I'm wondering, any of the donors that would like to address any or all of those questions before we close out?
I'll take the medical one. It's actually, I wish I had better news, but it's actually just a huge funding gap. Most of us on this call, I think all of us, and most LGBTI funders focus on policy and advocacy pieces or movement building. But I can't think of one that focuses on actual access to hormones and services. And it's just, it's a really problematic gap in the funding world.
Victor?
Thank you. I can just add to Rebecca's point as well that, for example, the public health program with Open Society also works on not just policy advocacy, but also on training medical specialists. But we don't do the trainings ourselves. We would fund a trans organization, for example, to do the training. And I think this is also obviously not enough in terms of having money for access to hormone treatment or for corrections. But I think there is a point also to be made that if we fund an organization that would, for example, be able to widen the pool of available experts who are willing to work on trans health, that is also helpful. But I do agree with Rebecca that there is never enough money for everything. And I've known that in some regions in Europe, some of our grantees have been successful either with raising money as organizations specifically for help for individuals, for health issues, or have been, for example, encouraging individuals to create their own fundraising campaigns and then making sure that these are widely distributed within the community. But still, again, this is not enough and will never be enough. And I think we need to rethink also how we like what kind of advocacy we support in terms of access to care and who pays for that care. And I think it's one of the bigger questions for us at the moment. And I wanted to add on the context piece as well. I think this obviously depends on the funder, and I do want to make this distinction that a number of us here are work for either private foundations or for public foundations. So public foundations typically fundraise for themselves like an NGO would, and public foundations have access to money from, let's say, someone's endowment or the money they made throughout their life and that they want to give out to different causes. But there are also government funders, bilateral also, or multilateral, so either individual governments or a consortium of governments gives out funding. And I think there's a difference in what kind of context is needed for applications to these donors. As Open Society, what I can say is that we usually ask grantees to describe a bit of the context that they work with, maximum half a page per hour application process. And this is only because these applications are further on reviewed by colleagues who may not necessarily have access to this context and who just need to see whether legally and through grant making practices everything is fine. But aside from that, I think it is the job of the program officer or any consultants that they work with to understand the context and to be able to convey that context further with other colleagues who are going to review these applications. So short to say, I think it is on our side to understand and be able to describe the context as best as we can for our internal purposes. And on the side of the potential grantee is to, for example, sit down and have a conversation with us about that context and describe it briefly in the application process. But of course, I also wanted to add that if you produce research, studies, reports, I personally love to receive them and to be able to read them because that also helps me understand how best to support the organization or an individual if we do individual grant making. So whatever you are producing as an organization is always welcome and is not just in vain. It's not just floating somewhere on the internet or in a publication format. It's read and it's important.
We are a bit over time. I want to express so much gratitude to all of you for the work you do in all very complicated contexts, as well as to the donors who have shared your time and thoughts with us today. I wish we had more time together, What I would like to suggest, because I know there are more questions, I'd like to offer that anybody with any of the members and community members who have questions, to feel free to send those to Anwar or Sanjar in whatever language works for you. And what we will do is we will bring those together. And if our friends and the donor side are so willing, share it with them, share those questions with them, and perhaps come together with some responses. Maybe even create a frequently asked questions with some of the concerns and tips and ideas of how do we all work together to survive this really complicated time and to be a stronger movement at the end of the day. So if that's okay with them, I have not talked to the donors about this, but if you're okay with that, is that all right? I'd love to continue to see how do we continue to get resources to the groups that need it the most. And
Absolutely.
With that, I'll turn over to Anwar.
Yeah, thank you, everyone. We are way beyond time. This is something that we usually do not do, but it felt like too much of an important discussion to cut it early. And I'm half excited, half sad that this is our closing webinar. But of course, this is just one of the many, different actions we will be doing in the frame of our COVID-19 response. We will be coming soon with other as well webinars, online training, since I guess, online life is something that we will have to adapt for, few other months now. And yeah, thank you so much for just your participation. Thank you for the amazing job you're doing. And please feel always free. My email now. I've been, annoying enough to send you, frequent reminders. So please feel free to reach out to me. Feel free to reach out to any of my colleagues. And TG's upcoming highlight is going to be our General Assembly that we are preparing for November the 7th. Those of you who are members already know that. We will also have throughout the month of October a series of online workshops to prepare this General Assembly. So for those of you who are members, please feel free to join, feel free to ask questions if you have. For those of you who are not member yet, feel free to reach out to me to maybe understand why is it also important that you, and especially you coming, to participate in such an important yet marginalized discussion. It is important that you also reach out to us and just join TGU and help us shape the future, of the trans movement in our region. So thank you again for being there. Thank you to the panelists, thank you to the donors, and just have all a great rest of your day, and talk to you hopefully very soon. Bye-bye, everyone.